And we're back, and we're moving into our conversation for today. We are joined by representatives of the Belize Diabetes Association, and of course, as a part of our commitment to keep you educated and informed on all things COVID-19, today we're focusing specifically on one of the vulnerable groups, and that's the diabetics in our country. We have with us on set Dr. Michelle West, who is the medical and scientific advisor to the association, and we have Lynette Valerio, who is the acting president. Good morning.
Good morning.
Ladies, thank you so much for being here.
Thank you so much for inviting us. It's always good to open your eyes on people's eyes with diabetes. And we're glad to be here.
So I think, of course, the topic that we're discussing this morning is on everybody's mind, of course, and that's the effects of the COVID-19. And for anybody who's been paying attention, to what's being said in the news, is that people with diabetes are one of the highest risk groups for, if somebody were to contract the virus. So perhaps you can start by talking about why that is and how the virus does affect somebody who does live with diabetes.
Okay, so the virus, as we know, right, it affects the respiratory via, okay? So it's a new virus, we're still figuring it out. And so far from the studies, it shows that everyone can get it, but who are most vulnerable to get complicated are persons with comorbidities, right? So for example, someone with diabetes, they are at high risk of having it. Now, diabetes is a condition we know, right, that the body is not able to use the glucose for us to convert into energy. So when we don't have that, we have the glucose level high in our blood, right? Patients will start to get complicated because we're not able to use this glucose, and your body needs glucose. It's the energy for your body to work with, right? So your body having to strain on trying to you find energy another way, all right? You have complications that comes with that. Now, if this virus comes in, that just adds to it, right? The virus on its own, it affects your respiratory via, and apart from just the diabetes, then your body would have to be actually trying to fight off the virus also. Yeah. So in both ways, your body is going to get very, very weak if that would happen, all right?
So it's working double hard to manage your diabetes and to fight off the infection, the virus.
The virus.
Because persons living with diabetes, their immune system is compromised. So it makes it harder for their body to fight this infection. So any persons who are living with diabetes acquire a virus, their body has to work harder because of the fluctuations in your glucose levels. The blood sugar goes up, goes down, so they're not able to fight the infection. And so for persons with diabetes, it becomes harder for them to get better and get well. So for what we have been doing is making this known to all our diabetics. As the World Health Organization says that, you mentioned diabetics are one of those who are vulnerable. And we need our members and people who are living with diabetes to take this very seriously.
Have you been hearing from them? I mean, I know the Diabetes Association, I can't go without saying that you work very closely with the population of people in this country who are diabetic, from children who were born with it to children who developed it to adults as well. And you offer low-cost strips and many other services. What are you hearing from your members at this point?
So at this point, we have sent out 2 press releases. The second one was distributed yesterday and I think over the weekend. So what we're telling our members and people who are living with diabetes, now is the time to stock up on your medication. We have given them specific instructions. We have been calling them, texting them. We have made contact with our local branches and the branches out districts. We have branches in all the districts except Orange Rock and San Ignacio. But we have contacted our branches and the chairpersons in those areas. They are told that to cancel or postpone all meetings, all health fairs at this time, all community and social gatherings, because a lot of people who are living with diabetes are elderly. And so our elderly are the ones who we said are more vulnerable to acquiring the disease. So it's very incumbent for those people to stay at home. We have also instructed them to get their medications. We're so glad to be working with the Ministry of Health and NHI because they are calling their patients to come for the medications. We don't want persons to go to the clinics and go to the hospitals and say, I'm made proud. So it's best that they send somebody to pick up their medications. And so the NHI clinics and the various health providers are contacting their persons who are living with diabetes to come for the medications. We're asking them to have at least 2 months supply. That's one. Have your medication.
2 months supply of your medication.
2 months supply.
Or insulin?
Or insulin, whatever. Some people take Laboride or metformin. They need to have at least 2 months supply of that now.
Okay.
So if you haven't been called, please call your health care provider and get your medication now. The second thing is we want to make sure that all persons living with diabetes have a monitor. That is so important that they have their monitors to test their glucose levels. Because there are times, and Dr. West would know, that sometimes the medicine that they're taking, whether it's the oral medication, tend to stop work as effective as it should be. And so they need to change or increase their dosage. Some people may need to go on insulin. So they need to test regularly to know what their sugar level ought to be. So that's very important. So they need to have supply strips because these things cost. And so they need to contact our office or get from their health pharmacist their strips.
Provider.
They also need...
Do you have enough in stock to be able to help people get through the next 2 months?
Correct. We do have enough in stock. And we have sufficient as well for our type 1s as well. You know, they need to have their insulin. So the other thing that we're telling our members and people living with diabetes to do is to be calm. You know, stress can elevate the glucose level. And stress can cause a whole lot of other complications.
I'm so glad you mentioned that. That's what I was thinking of. So
stress.
If I'm elderly or if I'm diabetic and if I'm both, I could just imagine, you know, I would be so worried about the potential of having this disease in the country because of the implications it would have on my health.
Correct.
So the stress level would be through the roof. Talk to us again about behaviors that they'll need to, because they'll also need to exercise. Diabetics should be encouraged to exercise.
Remain
But
calm.
should they go outdoors to exercise?
Not necessarily.
Yeah, you don't have to be outdoors to do your exercise, right? You can do your exercise at home, and we would encourage at home, in home, right? I mean, if you have the internet, you can look for exercises on there to do. I mean, we can do it at home. It's right now to decrease the exposure, okay? The more you can stay inside, the more you can be contained, then it's better, all right?
And the other thing that we want our members to have is a support group. Whether it's your family, loved ones, even us at the Belize Diabetes Association, we are here to provide support. These persons also need to make sure that they have emergency contact numbers in case anything should arrive. Because just imagine when COVID comes to Belize, the government may institute additional precautionary measures, such as limit movement of persons, total even shutdown. And so if you don't have your medication and if you don't have a support group, it will be very hard on you. So it's important that we take this with a sense of urgency, and people ought to be prepared for when COVID comes home.
You have a support group that usually meets at KHMH.
Yes.
Do you do an online group for people who don't want to come out or people across the country so they can kind of stay in touch and feel safe or at least have somewhere to vent with?
Online, not at this moment.
Okay.
But what we do, we have contact persons in the country, in various branches that they also could reach out to. And I could give the names of those persons and their contact numbers. So our association meets every third Saturday in each month at the IT vet at 4:00 p.m. So we always encourage people to sign and become a member or even come to our meetings. We're open to the general public, so they're invited to come. And so in times like these, when we have this pandemic on us, the support group at BDA, at our association, is there for everybody. Our executive group, you know, we all are keep in touch with each other. We communicate very regularly, and we have instituted some backup business continuity plan as well in the event the virus, you know, becomes so drastic.
I keep on saying that we're learning as we go along the information, and this is a benefit we have of not having a cases yet. So we know data is coming out of China, data is now coming out of Italy. From China, we know that diabetics are high risk. You're talking, it may be the second highest risk that you may have in developing severe and possible fatalities from the disease. We also know coming out of Italy that there is some look at it impacting the kidneys as well as the lungs, which means our diabetic patients and or kidney patients or renal patients are very much at risk.
Correct.
What can you do now when there's no case to kind of get yourself in the optimum position to be able to fight off the virus if you come in contact with it?
Okay. Normal, right? You would do your exercise, your balanced diet, your medication, you take it as regularly as you should. Well, we're talking about diabetes, so your regular glucose testing. But we need to start practicing and informing our public, the public, that hand washing needs to be done. All right, it's very, very, very important. Okay, we do know that. Well, it's a matter of time, I would say, before the virus reach here, right? It's a matter of time. So from now to that time, it's the basic that I said just now, your lifestyle modifications that you should do. But when it does reach, right, then you should practice the proper hand hygiene, okay? Try to keep a distance from social distance, right? And there's one thing that we are already adapted to, the cultural way of meeting people.
Yes.
So even that we have to try draw back from that a little bit. Right now, instead of shaking hands, hugging, so forth, you can just do the elbow, or you can do the feet, or you can salute or do like Mother Teresa, things like that, right? So it's keeping the distance and trying to regularly hand washing. I can't stress the hand washing thing because it's one of it's the way that it's most highly transmissible. Okay, so.
And the Ministry of Health has been so proactive in putting a whole lot of messages on the media. You know, the basic hand washing. They could, you know, they have the primary schools, and everybody is being encouraged to wash their hands, because those are things that we can do on our own. And for persons who are living with diabetes, again, it's best that they stay safe. And if you have a family member, your mom or dad, who is living with diabetes, you want to protect her as much as possible at this time.
Exactly.
You who get in contact with people in the media and people on the street, you want to be able to like limit, you know, your interaction, or basically have all the proper hygiene. And if you have loved ones who also are living with diabetes, let's say your significant other, your brother, sister, mom, whoever, you want to be careful where they go, because you want to limit their movement.
Okay, so let's talk about that. So there's what the diabetic has to do for themselves, but not very many diabetics live alone. They live with other people who perhaps are not as worried. Children, for example, juvenile diabetics, if you have them at home, or any other diabetic patient. What should I do? If I have a child or a mother or a spouse who's diabetic, what do I need to do in terms of protecting them?
So what I would say first, and Dr. West could add, you would have to protect your mom as much as possible. Limit visitors coming to your house to look for mom.
Yeah.
You know, mom could get in touch with everybody on phone, have FaceTime, WhatsApp, everything. Mom, you want to protect her. Like like the honeybees and the queen, you protect her. You know, nobody comes around her if they don't need to interact with her. And you want to make sure that mom if she has everything, her medication to time, you're testing her glucose level. You want to make sure that she also engage in therapeutic sessions, maybe relaxation techniques. Just have her relax and be calm. Talk to her. You don't want her to worry as well. So just protect your mom as much as possible, or your significant other who is living with diabetes.
And children?
As well. You want to make sure that they are as well, be cared for. They have their nutrition, make sure that they're properly eating and taking care of their diet. Maybe some exercise as well, and monitor their glucose levels as well. But again, limit outdoors for the kids. Limit interaction with other children as much. Again, like I said, like bees, protect the queen.
So it's mainly you protecting yourself first. If each of us try to protect ourselves, then we protect the people also around us. Okay? So you start from you first.
And,
okay?
We're talking about this in the context of, the COVID-19 or coronavirus, or, however it's being called. But a lot of these measures are actually protective from, disease in general, because we know that, you know, whether it's the COVID-19 or another thing, if a diabetic does contract, it's much harder for them to get better at the same rate that somebody who does not have live with the disease. So it's a measure that you can just put into place in your normal life. Even
that's the thing. That's why we're trying to reduce the panic. All right, it's the same thing that we've been doing before, so we just continue doing it the same, right?
Yeah.
The only difference is that there's no vaccine yet for COVID-19.
Yeah.
So it becomes more critical.
Yeah.
Now, there are things that you can do to minimize introducing the virus into your home or to your diabetic loved one.
Right.
And, you know, I know doctors definitely have these kind of protocols down pat, like leave your shoes outside, change your clothes, shower before you come in contact. Tell us about some of those things, those infectious control mechanisms that can help, especially if you have a vulnerable one at home.
Okay, so if you have been in contact with anyone, you know, that has cough or cold, when you get home, the first thing you should do is go and take a shower, okay? You take all your clothes off and you take a shower. Virus, bacteria, they tend to stay a lot in your hair. So that's why in the workplace, we usually should have our hairs in a bun, right? So when you go home, if that's the case, you have to wash your hair, right? And bathe thoroughly. The same thing too, you leave your shoe at the front. And if you have to deal with somebody who is sick, right, you should wear protective garments. Like every institution have what you would call personal protective equipments. Like for us in the medical field, that includes the goggles, the face mask, gloves, apron, and so forth. But for the population now, when the virus ever reaches, and you have people with cough, cold symptoms, etc., then you can protect yourself by using a mask, all right? Like for example, if you have to attend someone who has cold or cough, like caregivers do, you use your gloves and you make sure you dispose of it afterwards, right? You use your mask, you dispose of it afterwards. So the issue of should I use a mask if just for, you know, using the mask, we don't have any cases yet, but people want to start using their mask. Now, it's not advisable to do that as yet, because the mask right now, if you, it gives you a false sense of security, right?
Right.
I should have brought a mask. The mask actually on the front part, that is where most of the germs or the virus would stay.
Yeah.
So you having on the mask now and again would like touch your face ever so often, and then that gets on your hands, and then that is where.
I'll adjust the mask because it's something
mask.
strange on my hand, then I touch my eye.
Yeah.
I just put it in my body anyway.
And it's the same thing with the gloves. It gives us a false sense of security. But I mean, at some point, if you are working with somebody that does have, you know, cough, cold, flu symptoms, then you should use it and dispose of it. Okay.
You know, that sort of brings up an important topic, I think, which might be on everybody's mind. And that is, if you are around somebody with the symptoms, or let's say you are a diabetic and you start to develop something, you know, cold or flu symptoms, what do you do? Who should you contact? You know, what are the steps that you take in that sort of a situation?
Okay, so far since we don't have any case of the virus, right? Anybody with cough, cold, flu symptoms, most of the time, it's just symptomatic treatment. You know, you stay at home, you let the virus run its course, and you get over it. But now if we start getting cases, okay, we should think about it and consider it as a possibility. And so seek medical attention, okay, especially the diabetics, because you don't want to wait for it to get really complicated and then, as we talked about, it becoming a fatality, right?
Is it important? I mean, this is perhaps the most important time. Well, I don't want to. You should always have your glucose levels under control as best as possible, having the right diet and taking your medication and testing. But this is a particular time that you don't want to deviate from that. Is that what you would recommend to diabetics?
Definitely, definitely, yeah. We do have in place, I mentioned, support group in the various branches, and I could give their contact information if that's okay. So in Belize City, people living with diabetes can call the office. Our office numbers are 203-3333 or 678-9239. If after hours they want to talk to somebody, we have our diabetes educator, Mr. Anthony Castillo, our immediate past president.
Yeah.
His number is 610-2158. And myself, they can contact me at 610-0374. In Belmopan, we have Cornelia Marfield, 625-4231. Corozal, Lucas Hoare, 624-4476. Dangriga, Mr. Rudolph Serrano, 610-0905. Punta Gorda, Ms. Lucy Cayetano, 605-9854. The other tongues and keys, they can contact the Belize City office numbers. But we have in place a diabetes self-care management program where persons who are interested in managing their diabetes can contact us or those persons that I call to find out how best we can work with them.
Yeah.
Because diabetes, when people are living with diabetes, they need to have a support team.
Yeah.
Because it needs to be managed properly.
Yeah.
Because like I said, if it's not managed properly, complications will step in. And they do.
Yeah.
Many times, people end up with blurry vision, retinopathy,
Yeah.
periodontitis,
Yeah.
nephropathy, all these complications damage
Yeah,
their
there are already
organs.
so many risks
Yeah.
in being a diabetic with uncontrolled glucose. You wouldn't want to add this virus to it as well. So it's great that you're offering support to people because maybe they have questions, just little things that they want clarified. But what's key right now, the key messages is get it under control,
Yes.
keep it under control, keep your diet, your exercise,
Remain calm.
minimize your your stress level, but also contact
Yes.
with lots of people, and also stack up on 2 months worth
At least. Yeah.
of strips, insulin.
Medication.
Oral medications, and any support. And also, if they want to contact their nutritionist to find out how they can boost their immune system, that
Yeah.
would be something that they would want to do at this time too.
Excellent.
Boost up their immune system. And so their nutritionist or their dietitian can help with that aspect of their health.
Okay. Any other advice you have for diabetics at this time?
To remain calm, that is the number one thing, because we find that stress do elevate people's sugar levels.
Yeah.
And so it's best that the support team, their families and loved ones, reach out to them and let them remain calm. And we just want to support each other at this time, and we don't want anybody to be left behind.
Yeah.
That's right.
So the different branches is, and if you know somebody who is diabetic, your friend, family member, reach out to them and just find out how they're doing and how they're coping. Sometimes just by calling up our families and friends, that's also therapeutic to them.
Remind me once again, how many diabetics do we have in Belize?
Okay, in the whole country, we have about, registered with our association, about 650 to about 700 people.
Okay.
But in the entire country, the International Diabetes Federation Diabetes Atlas of the World, the 9th edition that was released in November 2019, state that the population of Belize, we have about 229.3 thousand people between the ages of 20 and 79, and out of that population, 14.9% is living with diabetes. 14.9% of our adult is living with diabetes. We have that, and that's type 2.
Yeah.
Type 1, we have about 89 children living with diabetes.
Yeah.
The statistics also says that in the country, 1 in every 7 person has diabetes. So the International Diabetes Federation Atlas also states globally, there is 463 million people living with diabetes globally. And there's 1.1 million who are children, additionally who are children. They say that 1 in 11 person is living with diabetes. 1 in 2 person has diabetes and don't know it. Every 8 seconds, somebody is dying from diabetes and or its complication. Every 8 seconds.
Okay. All right. So I'm trying to be calm for the diabetics that I do know. But I think you've given us such great advice. One, they have to recognize that they have to take extra care.
Exactly.
It's just that simple. It's what you may be thinking right now only of the elderly in your family. Don't lose sight of those who have other illnesses that they're trying to manage, and diabetics is definitely one of those high-risk groups. All right.
Yeah.
Ladies, thank you so much. The Diabetes Association has a Facebook page. It has an
Yes.
office at the corner of Central
American Boulevard and Mahogany Streets.
All right.
So they can reach us, contact us, call us, find us on Facebook,
Yeah.
and we'll be able to help. We're a support group,
Yeah.
and so our mission is to help everybody who's living with diabetes and also to save lives.
Thank you. We
Thank you
hope
too.
we help some people keep themselves prepared, right? We're going to go ahead and take a break, and when we come back, it'll be to discuss COVID and our mental health. So stay tuned.